Hey all, welcome back to the Real Life Pharmacology podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. Go check out reallifepharmacology.com. Get your free 31-page PDF. It's on the top 200. It's a great little study guide. It's a great review if you're out in practice or study prep for board exams, pharmacology exams throughout your career. So no-brainer, simply going to cost you an email is it. So go get that, reallifepharmacology.com. All right, the drug of the day today is lactulose. Brand name is Enulose. Generlac is another brand name I've heard utilized here. So this is technically classified as an osmotic laxative. So recall osmotic laxative, they draw water into the gut or GI tract basically. And that extra water is going to stimulate peristalsis and ultimately help with constipation management. Now in clinical practice, I rarely see it used for constipation. We've got a lot of other meds that we utilize, polyethylene glycol, stimulant laxatives, fiber supplements, and so on and so forth. So with that, where you are most likely, or where I most likely see this medication used, is in people with hepatic failure, cirrhosis, things like that, where ammonia levels or hepatic encephalopathy is present. So lactulose actually reduces ammonia levels. This is kind of a toxic buildup in the blood that can cause some CNS changes like confusion and stuff like that. So lactulose can be an important therapy in reducing ammonia levels. Now, how does it do that in hepatic encephalopathy? So basically, lactulose is broken down by bacteria in the gut, and this leads to acidic byproducts basically being produced. Now that acidic environment in the gut allows for the conversion of ammonia, NH3, to the ionized form, NH4+. When it's converted due to the extra floating H's in the gut, or positive hydrogen ions, that helps NH4 stay in the gut and ultimately is eliminated through the feces primarily there. So that's how it helps minimize ammonia in the bloodstream, is it actually converts it to NH4, which gives it a positive charge, and it doesn't allow that, or it's less likely to go into the bloodstream in that form compared to NH3, which pretty easily or readily passes into the bloodstream from the gut. And obviously, the more that accumulates in the bloodstream, the more and more likely we're going to have toxic type effects like those CNS changes and delirium and fall risk and coordination issues and so on and so forth. So that's how lactulose reduces ammonia levels. Now, dosing. How do we dose this? Dosing for constipation is usually just once a day. However, for hepatic encephalopathy, we really try to push the dose. And you'll often see this drug dose 2 to 4 times per day, maybe even up to 30 to 45 mils per day. But the ultimate goal in hepatic encephalopathy and reducing ammonia levels is to titrate lactulose to 2 to 3 soft stools per day. And this definitely can be a tricky balance with patients because obviously they don't want to have diarrhea or be running to the bathroom all the time, but we want to obviously bring down ammonia levels. So the typical goal titration is going to be 2 to 3 soft stools per day. And then obviously with that, we're going to be monitoring ammonia levels as well as potentially clinical symptoms if those ammonia levels are getting too high. As far as dosage forms available, there is a solution. Obviously, that solution is very, very sweet. So that can be an issue for some patients that really don't like that. It can be mixed with milk, water, or juice. So that potentially can help with that excessive sweetness issue if patients are bothered by that. Adverse drug reactions is probably what you're going to think of with any agent that's kind of a laxative. So you could have some, stomach cramping, pain, bloated, gassy feeling, maybe some stomach upset even, and then of course diarrhea as we push the dose higher in managing hepatic encephalopathy. If we're using it as a laxative, obviously we're trying to get a more loose stool, so that's going to be anticipated there. A couple other things that are mentioned in the package insert and other literature. Electrolyte changes are possible with chronic use. I typically don't worry about that too much, and if you're using chronic lactulose, it's probably for hepatic encephalopathy, and in that situation, you're probably monitoring labs pretty frequently anyway, including electrolytes there. So probably not a major issue to think about there, but I did want to mention it a little bit. And then there is the possibility for changes in blood sugars. There has been a recent study that says, maybe this isn't an issue at all, but it has been reported in the past. So I do throw it out here. If you see a person's blood sugars go crazy up, there is potential maybe, or at least reports previously that said lactulose could be contributing to that. However, I would ask further questions of, are you mixing that lactulose with something? So are you putting it with a bunch of fruit juice, for example, which is new or something different than the patient's usual routine? So again, not too big of a deal in my opinion, and we're going to be monitoring blood sugars anyway. But if you see, a crazy spike in blood sugars, you're probably going to investigate, and you might look at the lactulose as a potential consideration, but in the grand scheme of things, it's probably not real likely. Monitoring, if we're using it for constipation, we're going to look at bowel movements, of course. Fluid intake, we're going to want to increase that usually when we're managing constipation. Obviously, you got to think about patients clinically if they can't handle fluid overload, such as heart failure. That's one thing that we've got to be cautious with a little bit there. Ammonia levels with hepatic encephalopathy, if we're managing that, obviously we're going to check that. All right, let's take a quick break from our sponsor and we'll wrap up with drug interactions. If you're in the market for pharmacist board certification study material, like pharmacotherapy, ambulatory care, geriatrics, BCM TMS, NAPLEX exam, definitely go check out meded101.com/store, S-T-O-R-E. We've got a growing list of resources there, and you can help support this podcast by any purchases that you make there. So that is greatly appreciated. If you're not a pharmacist taking one of those board exams, we've got books on Amazon regarding case studies, polypharmacy, drug interactions in primary care, food drug interactions. So lots of different options if you're a healthcare professional trying to beef up on your medication education. So go check those out, support the sponsor, and we certainly appreciate it. All right, wrapping up with drug interactions. Warfarin, I wanted to mention with lactulose, there is the potential to enhance warfarin anticoagulation effects. So, most often with warfarin, we're going to be checking INR fairly regularly anyway. But adding lactulose could potentially increase that INR. I would say it's not a crazy high change or crazy significant drug interactions, but it is just something to be aware of there. Review for constipation meds. So while these next two aren't technically considered drug interactions, whenever I see a laxative being used or being necessary, like lactulose here, I always look at that medication list, make sure patients aren't on unnecessary anticholinergics. Maybe we can back off of opioids. So those are two classic examples of drugs that I see all the time in my polypharmacy patients that really compound the problem of constipation. So which with lactulose, we're obviously trying to manage there. And then same thing with hepatic encephalopathy and elevated ammonia levels. I always review the medication list when I see elevated ammonia levels. There are some drugs, classic example being valproic acid. I have seen this happen in practice. While not incredibly common, I think it is important to note that there are some meds that could increase ammonia levels. So I think that's important to make sure we address there. Now, obviously, we're going to be looking at these patients medically as well. If they clearly have cirrhosis, hepatic encephalopathy, that's likely the cause of elevated ammonia levels. But in any type of full assessment, you got to make sure somebody's looking at the medications and that medications aren't worsening a condition like elevated ammonia. All right, well, I think that's going to wrap up the podcast for today. Leave a rating review on iTunes or wherever you're listening. That's greatly appreciated. If you've purchased any books on Amazon or anything that way, leave us a rating review on there too. We greatly appreciate that. Share our content with others, certainly. Help support this podcast through the sponsor, meded101.com/store, S-T-O-R-E. Of course, you can reach out to me, mededucation101@gmail.com. If you have any questions, comments, suggestions for future podcast episodes, feel free to shoot me an email there. You can find me on LinkedIn as well, Eric Christensen, PharmD, BCPS, BCGP. With that, I'm going to sign off for today. Thank you so much for listening, and I hope you have a great rest of your day.